Celestia Quixs has been documenting what happens when the system designed to catch you falling decides instead to look away and then penalizes you for the silence.
Today, we're covering medical blacklisting, what it means when care denial creates data gaps, and how those gaps can threaten SSDI and SSI benefits through automated algorithmic review. Let's start with how that cycle actually works. The central tension here is this. When a patient is denied medical care, the absence of clinical data doesn't register as a care failure. It registers as potential improvement, and automated systems act on that misreading.
The Post puts it directly. The setup is a documented denial of care since October 2021 for chronic pulmonary aspergillosis, and the concern is what that absence signals upstream. Care gaps from blacklisting create absent clinical data that automated SSA systems and AI-driven continuing disability reviews may flag as medical improvement, threatening SSDI and SSI benefits.
So the upshot is that the system interprets silence as recovery. A patient who cannot access a prescriber, cannot generate new clinical records, and therefore looks, to an algorithm, like someone who stopped needing care.
And the label doing the heaviest lifting in that trap is therapeutic ineffectiveness, a clinical framing that shields the provider from abandonment claims while leaving the patient without recourse and without documentation. It's a tidy exit that forecloses every door behind it.
The Post's practical response to this is building what it calls a current health status portfolio. Consistent historical records, administrative correspondence, and a minimized digital trail to counter any automated determination of non-disability before it becomes a discontinuance.
The digital trail piece matters more than it sounds. The Post flags that SSA algorithms can cross-reference health apps, insurance portals, and wearable devices, and that consumer-grade data, stripped of context, can inadvertently signal improvement even when the underlying condition is severe and documented.
That concern extends beyond the individual case. The Post notes that a disabled young adult attending a costume party or doing karaoke with family generates a digital footprint an automated CDR system reads without nuance. Bar equals alcohol, not consistent with disability. And that CDRs are now automated, with no human review required to reverse a discontinuance finding.
Which means the granddaughter on SSI faces a structurally identical trap to the grandparent on SSDI, just with means testing layered on top.
The administrative record of the blacklisting itself becomes the defense. Correspondence with CMS and HHS OIG confirming they cannot compel treatment. Documents why new clinical notes are absent, which is exactly the gap an automated system would otherwise read as recovery.
There's also a side note worth flagging. The Post includes material on an instrumental track, Diagram of Disaster, from the album Abstract Survivors, Kindred in Hiding. Abstract IDM, experimental dub, 130 BPM, which is a very different kind of documentation of the same situation.
The through line across all of it is the same. When formal channels fail, the archive becomes the only available record of what actually happened.
The system isn't broken so much as it's working exactly as designed, just not for the people it was supposed to protect.
That gap between design and outcome is where the documentation lives. Next episode, we'll see what else Celestia Quixs is mapping at that edge.